Kamala Harris has chosen Tim Walz to be her running mate. He is the current governor of Minnesota. And I want to share an article with you. Tim Walz proudly turned Minnesota into a transgender haven and a danger zone for kids. As the rest of the world pumped the brakes on gender transition service for kids, with the UK and Sweden restricting puberty blockers, Minnesota is proudly hanging out a shingle as a haven for the medicalization of confused young people. Last April, Tim Walz, the Minnesota governor turned Democrat hopeful, signed the so-called Trans Refuge Bill, turning the Midwestern state into a legal sanctuary for children seeking gender affirming care like puberty blockers, cross sex hormones, and surgery. The controversial bill was sponsored by trans Minnesota State Rep. Lee Finke, who in a March 2024 speech at the United Theological Seminar of the Twin City talked about building a trans utopia for all ages in the North Star State, using the progressive law to incentivize people to move there. There are 25 states who have banned gender intervention for minors. If you promise trans refuge, then we need to increase the number of people who are offering gender affirming care because we already have a shortage. And now more people are coming, Fiki said. If you are a provider and you live in Missouri and all your clients can no longer access care, well, if they are leaving, you might also be interested in coming with your clients. Notice these are clients to Finke, not patients, just people swiping a credit card, not kids altering their bodies. We want to do internship programs and fellowship programs with children, Minnesota hospitals, and other places where people can learn gender affirming care, Finke said, speaking about transgender affirming care like it's a time honored martial art discipline or a type of massage. But it's not some soft cuddly therapy. It's barbaric, experimental medication being practiced in the most extreme cases on people who aren't even old enough to get tattoos or legally drink. These are children who are genetically in mental distress, but likely suffer from a litany of comorbidities such as depression, anxiety, or trauma, but have been led to believe that if only they can change their gender, these issues will disappear. They should have mental health intervention and parental guidance, not to have their bodies pumped with puberty blockers and cross-sex hormones, which wreak havoc on bones and cardiovascular health. This is Waltz, Minnesota nice. And this bill cites changes infringes on parental rights. As you can see, Tim Walz wants to make Minnesota a safe haven for transgender, especially children. And he wants to take away rights from parents to be able to say, no, I don't want my child to go through this. If you think about what puberty blockers are and what puberty blockers do, you also have to think about what age do a child have to start taking these puberty blockers if they're seeing or someone is telling them they're not born in the right body. Puberty starts around 8 or 9, and then it goes through a process, and then by the time they're a teenager, they fully went through puberty. When a male child is taking puberty blockers, It's designed to stop them from their voice changing to become deeper. It's designed to stop them from having hair, growing hair, beards, different things like that. It also stops them from producing testosterone, so their testicles do not form the way they should. And then the size of their penis basically stops growing. So they're gonna, for the rest of their lives, if they decide to keep their penis, it's gonna be very small. And then with the woman, or it's designed to stop her breast from developing, and then also stop her from having a menstrual cycle. So with these things happening in children around 8 and 9, they truly don't understand what's going on with their bodies. They truly don't understand what the ramifications of these decisions are going to have on them for the rest of their lives. That's why they have parents. Parents are supposed to be making the right decisions for their child, the best decisions for their child. If these kids don't change their body as far as surgically, and they just go ahead and grow up the way they are, then decide, you know what, the little boy decide, you know what, I'm no longer a girl, I really am a boy, I'm supposed to be a boy. He's going to look at his body and he's not going to be happy with the way his body is now looking. He's not going to be happy that he has a high-pitched voice like a woman. He's not going to be happy that he cannot perform like a male should perform if he's married in a relationship with a woman. He's not going to be able to perform like that because of those effects of the puberty blocker. And then the same thing with a woman. If she decides to grow up, her breast is not going to develop. She's not going to have a menstrual cycle, so she could never have kids. They're putting all this weight on little children who can't even take care of themselves, who can't even cook for themselves, who it's a lot of things they cannot even do for themselves because of their age. So do not put, and all this is experimental. The drugs, they truly don't know what type of side effects these drugs are going to have on these kids once they start getting older and grow up. All this is experimental. And then if they take it a step further and allow them to have these surgeries, they're going to be dealing with this for the rest of their lives. Mental distress, unhappy with the way their body look, because they would never be normal. They keep telling them you can become a girl or you could become a boy, but their body would never function as a male. A female body would never function as a male, and a male body would never function as a female. And because of the other things that have been done to them, their body would never function in their original gender, in their normal gender. It's not going to function the same because of those puberty blockers. If he is doing this in Minnesota, if he becomes vice president, you really think Kamala is going to tell him no? They're going to do whatever they can to push this into the rest of the states to make this normal for America, which it should not be. And I want to share a scripture. This is Psalms 106, 36 through 37 ESV. They served their idols, which became a snare to them. They sacrificed their sons and their daughters to the demons. And that's basically what's happening in America now. They're sacrificing their sons and daughters for their happiness, for their gratification, because it's not doing anything for these kids. Abortion. As with any medical procedure, there is a lot of information to learn and understand about abortion. You should be familiar with the procedure themselves and the risks involved so you are empowered to make the most informed decision possible for your body and your health. Abortion procedures. There are two legal types of abortion procedure, medical and surgical. Medical abortion, RU 486. The medical abortion method, commonly known as the abortion pill, utilizes two different medications to terminate pregnancy. The first pill, mifepristone, stops the flow of progesterone to the pregnancy. Progest- Progesterone is a hormone that is necessary for a pregnancy to continue. The second pill, misoprostol, causes contractions to occur and expel the embryo from the uterus. Surgical abortion, suction, aspiration, and dilution, dilution and evacuation, D&E, are the two kinds of surgical abortion procedure. Each one involves suctioning of the embryo from the uterus. The difference is the D&E is typically done during last term pregnancies. Physical risk. Both the medical and surgical abortion procedure involve risk. During a medical abortion, a woman may experience severe bleeding and cramping, infection, nausea and vomiting, diarrhea, incomplete abortion requiring a surgical procedure. This occurs 2 to 8% of the time. Some of the physical side effects of surgical abortion include severe bleeding and cramping, infection, uterine preformation, perforation, uterine preformation, scar tissue formation, tearing of cervix, incomplete abortion. Emotional risk. While abortion is a medical procedure, there are emotional risks to consider. Often women report feeling relief immediately after an abortion. However, later they begin to experience negative emotional side effects. These include mild to severe regret, guilt, shame, anger, anxiety, depression, and can even lead to physical effects like eating disorder. There are risks just as physical ones are, and it's important you're aware of these possibilities. I did a video a while back when it comes to a woman's choice to have abortion. I said even though I am a Christian, I am pro-choice, and I still stand that way. I still feel that way. I'm not saying that abortion is not the taking of the life of a child, because it is, because life begins as soon as the sperm fertilizes the egg. That is when life starts. And a lot of times they're lying to these people and they're saying, "Oh, you just have a blood clot. It's not actually a baby." I feel that anytime a woman decides to have an abortion, all the information should be given to her as far as what's going on with her baby, as well as what can happen to her body during abortion as well as after abortion. They lie, they make it seem like it's so easy and that there's no ramification, there's nothing that may transpire that can affect them as well as their child. But at the same time, because not all abortions are successful, there have been instances where children, parents went in past a certain time limit to have abortion. They tried to abort the child. Now the child is missing a limb because they was able to pull the arm off or the leg off, but they couldn't finish the abortion. She, ended up having a child and had to live with the fact that every time she looks at her child that's missing an arm or a leg, she know that's because she tried to, abort the baby and the doctor messed up. So you got to think about that one part. Then you also have to think about the truth of, in some women cases, depending on, because every situation is different, depending on the how far along she is, how her body heals, she may end up with scar tissue, and that tissue can cause her, when she do decide she wants to have an actually start a family, have a child, it can cause her to miscarry a lot, and it can become very hard for her to get pregnant and actually excuse me, and actually carry the baby full term, or her insides can be so damaged that she can never have a child again. It was like that one time she got pregnant. Now moving forward, her body is always going to reject that child because of how the insides may have a lot of scar tissue that cannot be reversed. These are the conversations that they don't have with these women. And I feel like whatever decision you make, because the reason I say I'm pro-choice, because God said, I put before you life and death, choose life. And I feel that the person has to make that decision for themselves, but knowing all the facts, knowing that sometimes when they actually are aborting the child, they are not pulling the baby out whole. They have to first go in and crush the skull of the child and then start taking it out of them piece by piece. And you see, because in that other videos, you see pictures where you see a little arm here, a little leg over here, and they just dump them. And sometimes they use, because the stem cells research, and sometimes they use, those aborted baby for other experiments. So it's a money game at the end of the day in some cases. But a lot of times they don't tell these women this is the full thing that can go on when you decide to have an abortion. I always feel that it's very important for a person to be able to make a fully informed decision. And that's also when it comes to, like I said, if you decide to vote or not to vote, make a fully informed decision on who you are voting for. As a Christian, do their values line up with God's value? Do their values line up with your value? Do you think they're going to protect the United States if there was a war, if there was a terrorist attack? Are they more focused on certain groups of people instead of the whole nation? Are they more focused on creating more issues and more problems, or are they focused on solving issues and solving problems? So that's how you have to think about it when you're going out there to vote. Make sure you're doing your due diligence to do different researches and get information so you can know, should I vote Democrat, Republican, or if you decide you're not going to vote at all, but make it your decision. A lot of times I hear people trying to shame people, especially black people. How can you be a black person and vote for Donald Trump? Oh, why are you not voting for Kamala because she's black? Don't let people bully you into voting for who they want you to vote for. Vote for whoever you want to vote for based on, do they value? If you're a Christian, your value should always line up with God's value. Not man's value, but God's value. And if you're not a Christian, then you should look at, do these people value line up with my value, how I feel as an individual? And not because someone bullied you or tried to make you feel ashamed or tried to talk down to you, because that's not freedom. Like I said, that's mental slavery. They talk about Donald Trump and slavery, but what they're doing is mental slavery. So don't fall for these games. Make an informed decision based on you're doing your own research and getting all the information. So I'm sure you're familiar with the saying, misery love company. I just want to read the definition to you. Sharing troubles. Unhappy people may find comfort in sharing their problems with others who are going through similar experiences. This can be called commemorating and can lead to social comparison, where people compare their situations to others. For example, someone might feel less disappointed if they learn that others in their building will also lose their view of a part rather than just them. And then we also have wishing others unhappiness. The saying may also mean that unhappy people want others to be unhappy too, so they can feel better about themselves. When I see what people are pushing on children who are not even old enough to hop in a car and drive, they're not old enough to make a decision about getting a tattoo, they're not old enough to make a decision about drinking, they cannot even go to the store and pick up alcohol or cigarettes for a family member because they're going to say you're too young. But they're allowing them to go through medical treatment that is not necessary, they do not need. That's just barbaric. And miserable people are doing this to these kids. They're unhappy with their lives, so they're making they know these kids are going to grow up unhappy, and that's what they want to happen. And then also these other people, when it comes to pushing abortion but not giving the same story, They know that sometimes these women regret having an abortion. Sometimes these women will see a child and think about, if I wouldn't have took my child's life, my baby would have been, 3 years old by now. Or they have friends, or now they can't have a child and they feeling, bad, horrible, and guilty. These other miserable people are making it okay by saying, no, this is going to make your life better. This is the best thing you can ever do. When in reality, it's not, because your body wasn't designed to have someone come in and snatch out a child that's growing in you. And it can have other effects on you for the rest of your life. So I feel every decision a person makes should be an informed decision, and you should not go out your way to hurt children. That's just pure evil.